Hello, welcome everyone to this webinar that will feature an overview of the current landscape of telemedicine and e-health in Tunisia. Today's webinar is part of a series of webinars that we at the International Society for Telemedicine and eHealth are hosting together with our national member societies across the world. This is already the sixth edition. We started back in January, and it is the group of national members who's been putting these webinars together. And today, for the webinar with a focus on Tunisia, we're very pleased to be collaborating with our national member in Tunisia, the Tunisian Society for Telemedicine and eHealth. Obviously, we'll go right into the heart of the matter, but just before that, and for you who may not be fully familiar yet with the International Society for Telemedicine, let me just point out a couple of things. We are a global network of digital health stakeholders. The society was established back in 1997 and has gradually advanced and grown steadily since then. And the basis of the societies are national members who represent digital health stakeholders in their countries, but we have other members, healthcare providers, telehealth providers, companies providing the platforms and the technical solutions, researchers, educators, individuals with an interest and an activity in e-health, telemedicine, digital health. So for anyone in this field who is not yet a member, we certainly encourage you to join. We are a networking society trying to create connections across countries, across continents, across people with different backgrounds and different professions. They come together in working groups, certain thematic working groups on specific medical disciplines or on more transversal topics. Education, training is an important focus for our society and our members, as well as accreditation and the quality assurance of telehealth services. We have student activities, contest and award each year for students. And we're also working with partners and organizations on looking at funding and investment in new digital health technologies and solutions. This webinar is being recorded and will be available on our YouTube channel, where you can also find previous webinars in this series, as well as other webinars that we are holding with our members, with our working groups and our partners. So that's all for now from me. If you have any questions, feel free to reach out to us, or if you want to join as a member, we definitely look forward to hearing from you. And with that, I will now hand over to our Tunisian colleagues. They have actually pre-recorded the presentation, so we're going to play that video, which is very nicely done, as you will see immediately. And after that, we have our colleagues from Tunisia here as well online who will be able to respond or comment to anything that you drop in the chat, any questions, any comments you have about things you will hear in during the presentations. So let me go ahead and now share the video. Making sure everything should be good. And there we go. So enjoy and feel free to drop your questions in the chat.
Welcome, dear friends, dear colleagues. It's our pleasure to be with you. I am Riyad Gouider, doctor and neurologist, Secretary General of the Tunisian Society of eHealth and Telemedicine, and we are proud and happy to participate to the International Society for eHealth and Telemedicine National Members Webinar Series. In this series, we will present our society, and it's my pleasure to introduce Dr. Rida Kishrid, the president of our society. Without further ado, Dr. Kishrid, the floor is yours.
Pleasure for me to welcome you and to introduce this session dedicated to the development of digital health in Tunisia. In 1996, Tunisia established the first remote medical links between hospitals, making the beginning of telemedicine initiatives and encouraging physicians to promote telemedicine through a dedicated scientific organization. On the 20th of September 2000, the Tunisian Society of Telemedicine was officially established to collaborate with national scientific and healthcare institutions in advancing telemedicine, electronic medical records, tele-expertise, teleconsultation, and digital health services. In 2010, the society expanded to include IT engineers and other healthcare professionals and adopted the name Tunisian Society of Telemedicine and eHealth. Since 2010, the society has contributed to developing the legal framework for telemedicine, contribute to the design of the national eHealth strategy, building stronger partnerships with international digital health organizations, and co-organization of an annual international forum dedicated to digital health and to practical contribution of artificial intelligence to medical practice. Since the COVID-19 pandemic, digital has emerged from its confinement and has been remarkable growth. In a few moments, representatives of the Ministry of Health will present the significant progress achieved in the field of eHealth, particularly with regard to the digital hospital. In conclusion, we remain confident that digital health will continue to play a key role in improving the quality, accessibility, and efficiency of healthcare for the future. Thank you for your attention.
Thank you, Mr. President, for this nice introduction that explains what's going on. And now we will go on depth of all these details with several presentations. Some of them you will see are short, some of them are more explaining what's going on. Please stay with us. Thank you, and after the presentation of our society by our most senior member, our president, Rida Kishrid, I have the pleasure now to have with me our most junior but talented member, Dr. Youssef Abida, who is the Secretary General agent with me, working with me, the Vice Secretary General, and he is also a very active member in the society. We will have the pleasure now to share with you the history and current activities of the Tunisian Society of Telemedicine and eHealth in the frame of this webinar of the International Society for Telemedicine and eHealth. So, our society is not one of the eldest one in our international network, but nevertheless, if you see, the first experience was on 96. That was the beginning of telemedicine and eHealth in Tunisia, really, and the introduction of telemedicine in the strategic IT technology. And for this, I think that one of our guests, Dr. Karim Bouhlila, will speak better than me about this. The foundation of the Tunisian Society of Telemedicine was before you did medicine, I think.
Yeah.
It was in 2000. It was a response to recommendation from International Telemedicine Congress to promote telemedicine in Tunisia. These are the founding members, and you see that Dr. Aziz Matri, who was the past president and honorary president, and who did a huge work for this society, and who did the fundamentals of this society. At this moment, Dr. Rida Kashid was also the founder, but being a minister of health at the same time, he didn't be very active. Now, he is coming back as our president to promote our society. You see the other members who were founding one. On the same time that you have the Tunisian Society of Telemedicine, there was another society with the late Ali Harmal and Dr. Rashid Hadrandan, who has built another society, the Tunisian Medical Informatics Society. It has activities on the years 2001 to 2000, more than 10, and after this there was a merge between the two societies, and I have the honor to have been in both. One of the most important events, I think also that at this moment, you just perhaps began your medicine studies there, it was the World Summit of Informatics Society, and it was this information society made by the WHO. You see here the Secretary General of the United Nations, Kofi Annan. He was in Tunisia. There was a huge gathering of more than 18,000 participants for this meeting. We did in this an activity, and you see Mr. Zuhair Turki, who was the director of the Center of Informatics of the Ministry of Health, one of the most prestigious informaticians at this time. In 2006, we did with the two societies of informatics and telemedicine, we did a gathering in our faculties. It's one of the academic work we did, and I want to say that there was a lot of academic work that we will speak about during this presentation. And in this meeting, there was all the presidents and the deans of the French faculties of medicine and universities. And we made a meeting with the late Abdeljalil Zaouch, our dean, about e-learning, telemedicine, and all these activities. 2009 and beyond, the scope was the expansion. And you see, this is the board of the society, and we integrated new members of IT and telecommunication engineers, and we changed the name of the society, being the Tunisian Society of Telemedicine and eHealth. One of the most strategic alliances we have was with CATEL. CATEL is the gathering of the Tunisian telehealth actors. And we made with them an agreement, and we see the director of CATEL here with our group, with the past president, past minister of health, Abderraouf Sharif, our late Azza Hamou, and others working on telemedicine. With CATEL, we did a lot of initiatives. One of them was in our department, having the launch of digital investment program and doing telehealth activities together. One of the most important achievements is the law adopted by the parliament in 2018. It took several years to be done. It took several years to be adopted. It took several years to be in the ground. And that's what we did on this telemedicine law. There was a lot of amendments, and you see our late Slim Ben Salah, who was with Professor Aziz Matri. Professor Slim Ben Salah, who was one of the most active members, is one who was in the parliament as president of the Council of Order. And this make the law pass with 126 votes in favor and 9 abstentions. The forum and the international forum. I think at this moment you began to join us. Can you speak a little about Yusuf?
Yeah. Thank you, Professor Guider. It's a great honor to be with you and to speak about the history of our society. So the International Forum of Digital Health is one of the main activities of our society. The first edition took place in 2016, And the initial theme there was Tunisia facing the digital health revolution. Since then, the forum was launched and the event took place once a year. This is a short video about the forum. And,
I think that here you have people that are very important for our society. You see here STTeS the organizer, and here our current
Ministry of Health, yeah. Dr. Rida Kashri, the president of our society here, giving an interview. And Professor Riyad Guider, who is giving also another interview. This was in 2016, the first edition. After that...
This edition, you see in this slide, we have the group of people who are very interested in telemedicine and e-health. I have to say that we invite every year people, colleagues, from all over part of the world. And here you see some sub-Saharan colleagues, and Dr. Aziz Matri and the Society of Telemedicine have built a network and even a Society of Telemedicine and e-health in Africa. Another shot of the meeting, that was after the COVID period. And you see that everyone was wearing a mask.
Yeah. And this was the 2025 forum with Professor Mostafa Ferjani, the Ministry of Health, and Dr. Rida Kashri. And the theme was natural intelligence and artificial intelligence in the service of the patient. This was the last edition of our forum. And here there were startup competition with all the three winners in the photo.
Yes, and you see that in this photo, we will speak about the startup and the partnership between public and private. But what we are doing is trying to help the startup to be competitive, and there's a jury with a hackathon on the startup, choosing what are the best startup. This is done with the help of the ambassador of China that you see in this photo. This book chapter we wrote in what you see, A Century of Telemedicine. It was a book that was provided and pushed by F. Levens who, and the International Society. And we wrote a chapter on this book, Telemedicine and e-health in Tunisia toward digitalization and interactive health. We can provide it to you if you need it. Now we're going to other activities, and these other activities are very important for us. Yusuf, what are rapidly these activities?
Yeah, we are involved in many other activities besides the forum. It consists of participating in high-level academic and institutional meetings, engage in regional and international e-health networks, organize trainings and webinars for healthcare professionals, including during COVID-19, and to contribute to national strategic discussion and digitalization. And last but not least, to promote AI and health innovation through hackathons and specialized forums. This was the last activity that we did, and it was in the Council of Physicians in Tunis, and we spoke about robotics and artificial intelligence in surgery.
What was interesting in this activity is that the people now working on surgery, robotics, and all this activity, you have a huge interest, either from the physicians, but also from the engineers who are working on this. And I was very surprised because I learned a lot, because I was not very aware about this twin concept. It was explained to the doctor, very well explained. And I think that this kind of activity of vulgarization of notions for doctors by the engineers or by people from the medical field who know this is very important to just have a bridge in the gap that it is now between the doctors, the physicians, and the new technologies.
Absolutely. And those are our main partners, the Ministry of Health, the magazine Reality, which help us organize the forum, and along with international partners, the International Society of Telemedicine and eHealth, the European Society of Telemedicine, the French Society of Telemedicine and Cartel Group. We talked about.
Yes, these are, I will say, summary of our partners, but we have also other partners in the regions, like the Moroccan or the Algerian Societies of Telemedicine. We collaborated also with the Egyptian part in our Mediterranean, and we are very happy to be included, I will say, in our prolongation, either Arab, African or Mediterranean, to work on telemedicine and to have the network. But I think that we are not complete if we don't speak of what happened in telemedicine from the Ministry of Health vision with Dr. Karim Bouhlila, who was one of the pioneers, and that we will have the pleasure to hear now after this talk. Thank you so much. My pleasure now to introduce Dr. Karim Bouhlila, who is an engineer in informatics and all the new technologies, and he is, I think, the live memory of our society and of the Ministry of Health also, because he was in the informatics department of Ministry of Health. Karim, the next slide, please. You remember with me Professor Slim Ben Salah. I wanted to give him a tribute. He was one. Yes. He was the vice president of our society. He passed away a few months ago, and he's still alive in our memory. Here you have the board of the society, the new one. And you see that Karim Bouhlila is the second after Razi, which is the first, and who will be the last presenter in our webinar. So, Karim, can you say to us what happened in the telemedicine in Tunisia, please?
Thank you, Dr. Guider. The telemedicine in Tunisia began in the middle of 1990s through individual initiative undertaken by physicians and computer scientists who were convinced of the need to improve access to specialized healthcare in regional area. The Ministry of Health established by decree of May 1996 the Technical Committee of Telemedicine, which was tasked with reviewing projects and defining a national strategy. As early as 1996, a first experiment was conducted through a link established between La Rabta Hospital in Tunis and Paul Brousse Hospital in Villejuif in France. And in 1997, a permanent teleradiology link was installed between La Timone Hospital in Marseille and the Children's Hospital of Tunis. The year 1998 was marked by the organization in Tunis of an international symposium dedicated to telemedicine. In parallel, the Tunisian Society of Telemedicine and eHealth was established in 1999. The initial experiences resulted in the deployment of 26 telemedicine sites between 2000 and 2010, with a total investment exceeding 700,000 Tunisian dinars. These sites were installed in 8 university hospitals, 5 specialized centers, and 6 regional hospitals. The project implemented included 14 teleradiology sites, 3 telepathology, 2 teleophthalmology, and 7 video conferencing sites. Data exchange relied on ISDN in 17 sites and on satellite link in 3 institutions. During the year 2010, assessment conducted by the Computer Center of the Ministry of Health revealed a very low utilization rate of equipment, a gradual loss of interest among physicians, and the abandonment of many workstations. 4 national commissions were established to address this issue, particularly regarding the legal framework and the remuneration of telemedicine services. the STTeH was involved. This effort ultimately resulted in Decree of April 2022, which sets out the general condition governing the practice of telemedicine in Tunisia, supplemented by Decree of December 2024, which define the remuneration modality for telemedicine services. Many challenges remain, but the existence of a regulatory framework constitutes significant assets for the future development of telemedicine in Tunisia.
Thank you, Dr. Karim Bouhlila, for this very enlightening presentation of what happened. I witnessed this with you, and there was a lot of hope, a lot of deceptions. But what is more important is that from this hope, this deception, was born the law on telemedicine, and now telemedicine practice is remunerated and is part of the legal framework and the legal activity of medicine and health in Tunisia. Thank you again.
Thank you.
After the brilliant presentation of Dr. Bouhlila, it's now my pleasure to invite someone who is not in the board of the society, but nevertheless one of the most important components of our telemedicine in Tunisia. I'm speaking about Professor Habiba Mizouni, one of the leaders, the pioneers in telemedicine. She's doing a huge job in Tunisia, and I want really to give her a tribute for what she's doing. She was designed by the Ministry Public of Health to present what's going on digital telehealth in Tunisia through our ministry. Professor Mizouni, the floor is yours, and thank you for being with us.
Thank you very much, Professor Riyad Guider. Thank you very much for the invitation and for the presentation. As you said, I'm Habiba Mizouni. I'm a professor of radiology at the Faculty of Medicine of Tunis. I'm head of department of radiology at L'Arabta University Hospital. Throughout my career, I have had the honor of contributing to the development and implementation of several national programs, including teleradiology, telebreast imaging, telestroke, teleretinography initiatives. I'm also part of the team of the first digital hospital in Tunisia, and today I will introduce the first digital hospital in Africa and Tunisia, and the member of the National Committee for the digital transformation of the healthcare system. Today, Tunisia is engaged in a profound transformation of its healthcare system, driven by an ambitious digital strategy, and the objective is clear: to modernize healthcare delivery and ensure equitable access to high-quality services across the entire country. This strategy is built on several key pillars. First, the implementation of a unique patient identifier, interoperable systems, secure national data platforms, and modernized network infrastructure. Also, the creation of a national center for artificial intelligence in healthcare. This is not just a technological project. It's really for us a project of deep transformation and a project of equity. In Tunisia, some regions still lack medical specialists. The digital hospital directly addresses this challenge. It's connected to hospitals across the entire country through a very high-speed fiber optic network. This model reverses the traditional logic. It's no longer the patient who travels to expertise, it's the expertise that comes to the patient. And the impact is immediate and tangible. For the patient, faster access to doctors, fewer unnecessary trips, and continuity of care, even in the most remote areas and even in holidays. For the healthcare system, better use of resources reduces delays and costs and improved quality and safety of care. And for healthcare professionals, the ability to work in networks and to be supported by artificial intelligence for decision making. However, all of this depends on one essential condition: the sovereign foundation. Because, as you know, without sovereignty there is no trust, and without trust there is no sustainable transformation. A sovereign foundation means the ability to control our health data, our technologies, and our security. Because health data is not like any other data. It's sensitive, it's critical, and it's strategic. Losing control means weakening the entire healthcare system. The digital hospital is entirely built on this foundation. And this is not a technological choice, it's a political and strategic one. In practice, now, many projects are already operational. First project is teleradiology. And now, we're happy to say that through our national teleradiology solution, we cover 100% of the CT and MRI needs of regional hospitals. Now more than 25 hospitals are connected with over 50,000 examinations already performed, and activity continues to grow steadily. We have also deployed teleconsultation, connecting more than 30 health facilities across multiple specialties: dermatology, cardiology, diabetology, psychiatry, and much more. A major initiative is teleophthalmology, particularly for monitoring diabetic patients. Through teleretinography, we can early detect retinal complications of diabetes and prevent blindness. The digital hospital also contributes to breast cancer screening, which remains the most common cancer among women in Tunisia. A national screening program is being deployed using telemammography, tele-ultrasound, and artificial intelligence to enable early and large-scale detection for women over 45. In emergency care, we support the management of myocardial infarction with already measurable improvements in rapid access to cath labs. Another key example is telestroke. Stroke is the second leading cause of death in Tunisia. This system enables more remote neurological and radiological expertise in regional hospitals, which is a critical goal: rapid treatment to save lives and prevent disability. We are also developing telepathology with applications in oncology and in the diagnosis of infectious and chronic disease. Another strategic focus is the development of a national AI solution. Clearly, important AI systems may be disconnected from local realities, less effective and potentially based. In contrast, national developed AI enables more accurate, fair, and context-adapted medicine. However, this transformation also creates new vulnerabilities. In a digital hospital, a cyber attack does not only affect data, it can put lives at risk. Cybersecurity, therefore, becomes a fundamental pillar. Without security, no trust. Without trust, no adoption. And without adoption, no transformation. Protecting health data means protecting citizens' privacy, the integrity of healthcare system, and national decision-making capacity. Today, the digital hospital is a concrete demonstration of what digital technology can achieve: reducing inequalities, overcoming distance, and really placing patient back to the center of care of all the healthcare system. Digital technology does not replace human care, it makes it stronger. What we are building today is not only a national model, it's a sovereign model designed to meet our specific needs and reality. Thank you very much for the attention.
Thank you, Professor Mizouni. Thank you, Habiba. I introduced you with a word that you considered very important, but your talk justified my presentation at the beginning. And I just want to say we spoke about the past, the present of the telemedicine in the hospital and the digital hospital. But I know that there's a lot of work going for the future. We have a country where we have discrepancies in the medical populations, with more people in the cities than in the rural regions. And I know that you are working a lot on having this inequality solved. What is the future of the digital hospital in Tunisia?
Thank you. I think really that the future will be great, not just in Tunisia, but in Africa. Why? Because telemedicine today is something which is necessary, something which is mandatory, and I think really that many challenges will be achieved. The challenges about equity, about security, about continuity of healthcare, about democratization of access to health. So my response, how I see the future, I see it as a great future of telemedicine in the service of Tunisian people everywhere and every time.
Thank you for all these words. I think that they come from the heart and also from the great mind. The future, I divide with that the future will be for the telemedicine, for the digital hospital. There will be an essential part of our medicine in Tunisia, 3,000 years of civilization, with telemedicine, with telehealth, and one of the examples that we are working together, the telestroke,
yes,
which is a very important achievement that we did in our country. Thank you again.
Thank you.
One of our last talk, but not least, is done by Dr. Razi Miliani, our Deputy Treasurer, one of the most known experts I know in health and digital and artificial intelligence. He will present us the public-private partnership success story in Tunisia with enhancement on 2 or 3 actions that where he was involved. Dr. Razi Miliani, please, can you go more in depth in this partnership?
Okay. Thank you for hosting me, Dr. Guider. I'm glad to present some success stories from Tunisian public and private partnerships.
Thank you.
When discussing public-private partnerships in digital health in Tunisia, I believe it's important to start with the broader innovation ecosystem that has emerged over the past few years. A major milestone was the launch of the Tunisian Startup Act in 2018. This pioneering initiative created one of the most supportive startup ecosystems in Africa and the MENA region, providing entrepreneurs with incentives, funding opportunities, and a favorable regulatory framework. The impact has been significant. Today, around 10% of Tunisia's labeled startups operate in the healthcare sector, developing solutions in telemedicine, health data management, AI, digital therapeutics, and patient engagement. Beyond the numbers, this ecosystem has produced globally recognized success stories. One of the most notable examples is ISfTeH, a Tunisian-founded AI company that became one of the largest AI acquisitions ever achieved outside the US. This success demonstrates that Tunisian talent can create technologies with global impact, including applications in healthcare and life science. Public-private collaboration became particularly visible during the COVID-19 pandemic through the eVax platform. While not a traditional PPP in the strict contractual sense, eVax represents an excellent example of collaboration between public institutions and the Tunisian digital ecosystem. The platform enabled the registration, scheduling, and monitoring of the national vaccination campaign. Thanks to this digital infrastructure and the mobilization of both public and the private stakeholders, Tunisia achieved a remarkable milestone by administering the first vaccine doses to more than 500,000 citizens in a single day, representing approximately 5% of the population. This experience demonstrated how digital innovation, when supported by strong public leadership and private sector expertise, can rapidly scale and deliver tangible public health outcomes. Looking ahead, Tunisia has a unique opportunity to build on this success by strengthening partnerships between healthcare institutions, startups, technology companies, universities, and regulators. The country can accelerate the deployment of telemedicine, digital health services, and AI-powered healthcare solutions. The lesson from Tunisia is clear. Innovation flourishes when public vision and private agility work together.
I think that your conclusion was, I think, a very beautiful summary of what I think also. You said that the innovation flourishes when public vision and private agility work together. I can't agree more than this. And I think that Dr. Mohammed Ben Hamida, who is following, will show us how things can evolve. Thanks again, Dr. Razi Miliani, for this brilliant presentation.
Thank you, Dr. Guider.
Following the case examples and success stories by Dr. Razi Miliani, it's my pleasure now to introduce Dr. Mohammed Ben Hamida, which is the Vice President of our society, and who will give other examples of success between the private and public sectors. Please, Dr. Ben Hamida.
Thank you, Dr. Guider. I have the pleasure to present you Tunisia rapidly growing health tech ecosystem. We have in Tunisia 150 health tech and digital health startups, telemedicine, AI, remote monitoring, and a strong ICT talent and gateway to Africa. A major regulatory breakthroughs in telemedicine. In June 2024, telemedicine regulation published and legal framework for digital health platforms, health data protection and interoperability, and accelerators in nationwide deployment. The public-private collaboration through POCS, the Ministry of Health and the SIMS partnerships is developed, and proof of concept deployment and real-world testing and validation, teleconsultation, AI, MedHealth, and eHealth. The PPP model for healthcare innovation, we have public-private collaboration in hospital, startups, investor, university, healthcare modernization, and improved patient access and outcomes. Vision 2013, Regional Digital Health Hub, nationwide telemedicine in Tunisia, AI-enabled healthcare, living labs and innovation centers, African expansion of Tunisian health tech.
Thank you, Dr. Ben Hamida. Really, I'm working in Tunisia in the public sector, and I was not aware of such possibilities. So I will just say the message: the people who want to work in Tunisia with the START Act are very welcome to work this. Again, it was a lightning presentation, you and Dr. Razi Miliani, and I hope it will be followed by other initiatives.
Thank you.
Thank you so much. Thanks for all the presenters for explaining what's going on in Tunisia for the current landscape of telemedicine and e-health. We didn't spoke about a lot on this presentation about artificial intelligence. I hope that we will do it on the next webinar, speaking about what we are doing. This is also a field where we are working a lot and where things are moving, I will say daily. And people on the ground are now working with artificial intelligence in Tunisia, we in health and e-health. These results for work which is ongoing will be something that will change our medical practice. And as I said, we will be happy to share it among a webinar or among a meeting of the International Society for Telehealth and for eHealth and Telemedicine soon. Yusuf, you are working on artificial intelligence, I know. Can you just on 2-3 minutes say what you are doing on this field?
Artificial intelligence in health is a growing field, and as neurologists, we are working on several aspects of artificial intelligence, including diagnosis, treatment, chatbots, and large language models that help physicians in taking decisions and push for the precision medicine, which is finally in the service of the patient.
I know that you are very modest. I know that you are also working on the databases, that you have a huge databases in Alzheimer's, Parkinson's, and others. And as said Professor Mizouni Habiba, the sovereignty on the managing the data through artificial intelligence and other activities is one of the most important points in the future, and deserves for itself another episode of webinars. To summarize what's going on, we presented to you our society, we presented the activity, we presented what's going on our hospitals, in our civilian societies. We presented also what you are doing in cooperation with other countries, especially in sub-Saharan Africa or Mediterranean landscape. And also, we were proud to show you the partnership between private sector and public through the presentation that you received. Now, we have finished all this presentation and are very eager to receive your questions, your comments in the few minutes who follows. So, stay with us.
Thank you very much to our Tunisian colleagues for this wonderful presentation, an overview of what is happening in Tunisia, what has been done, and some of what the future will bring. We have several of the Tunisian society's officials and board members here present, and I saw there were a couple of questions or comments in the chat. Some were already responded to, but I would like to give the floor to Dr. Abida or Ben Hamida or any of the others to maybe review some of these questions. There was something about the interoperability in hospitals, about surgical robots, which medical records are being used in Tunisia. Is it one type of record, one system? Are there different ones in use? So I would like to give you the floor. Maybe Dr. Abida.
Hello.
Hello. Go ahead.
Hello, good evening, everyone. I want to thank the International Society for Telemedicine and eHealth to give us the opportunity to present to you what is happening in our society and what is happening in the country in the matter of telemedicine and eHealth. There was 3 or 4 questions I saw in the chat. I can respond to the question treating the interoperability of the electronic medical records. I can say that now regarding the electronic medical record, this is probably a big challenge that we face in digital health in Tunisia. And we have, let me say, multiple systems. There is public hospitals that use a platform called the DMI, Dossier Médical Informatisé. The private clinics have their own electronic medical records, and some primary care centers that have separate solution. So true interoperability would mean that a patient can be seen in a regional hospital and could have his records accessed by another specialist in the capital or in a university hospital. So I can say that there are ongoing efforts at the Ministry of Health to create a national health data exchange platform, but we are not there yet. In short, I can see that we know what we need now. We have the vision, and we'll still be in early stages, but I think that there is a will, a political will to enhance and to have the interoperability system working in Tunisia.
What I can add, excuse me, this is Riyad Guider, the Secretary General. What I can add is that there's also an effort to mix this what is done by the insurance, the medical insurance, to have a unified file with a unified identification for the patients, in order to have all the files, not only one who are on the public sector, but all the healthcare files accessible for the healthcare provider.
Okay, thank you for those clarifications and insights. There was something else now about the constraints of deploying artificial intelligence in healthcare, and how to address them. Is that something one of you would like to pick up, maybe Razi Meliani, if you're able to come on? This was a topic that you also addressed. Yeah, go ahead.
If Razi is not there, what I can say is
I'm
that
here,
there's
Dr.
a
Guider.
huge...
I'm here, Dr. Guider.
Go ahead, Razi. You are the specialist. Go.
أنا؟ Do you hear me?
Yes, please go ahead.
Okay. Now we are using artificial intelligence. I'm in pharma supply chain, which my specialty. We are using AI and generative AI and agentic AI to secure medicines. As you know, 10% of medical products in a country with medium and low income are substandard or falsified. And to secure medicines and medical products, we are using this technology and it helps us to accelerate the deployment of GDP, good distribution practices. And I will share with you 3 use cases today of how we are using this technology. For the first one, this technology, it helps us to write SOPs and also to update them if there is any evolution in regulation. The second use case is this technology. It play the role of an assistant for our logistics team, and to ask to answer to all their questions and all their requests. And also this technology, this assistant can train our logistics team, and this is very, very interesting. And the last one, if there is any deviation in this technology, write the report and suggest a strategy to resolve the problems. This is what I want to share, how we are using now agentic and generative AI to secure medicines here in Tunisia.
Okay, thank you very much. Yes, it's always good to hear the practical implementation, real world examples. I think that gives a clear indication to others as to how it's being used, how it's implemented, and how that works and what the benefits are, but also at the same time what maybe some of the challenges have been. And so we're always encouraging as International Society for Telemedicine and eHealth this exchange and this collaboration between people from different countries, different parts of the world, different backgrounds, to learn from each other, because so much has already been done and is being done, and it's good to know about that so that others can learn and that it can help them in their own health systems and health delivery, etc. One more thing I see here in the chat is that whether the telemedicine platform being used, I guess this was about some of the national programs in different medical disciplines, whether that helps to deal with the fragmentation of information. I guess that's also very much related to the healthcare record, the patient record, as long as information is made available and shared, that should indeed help to avoid too much fragmentation. But if any of you have some further insights or comments on that about fragmentation and how to avoid it and how to make sure that all the information is readily available to all healthcare specialists and providers who need to deal with the patient.
Thank you. I'm Mohammed bin Hamida, and the PPP can evade and the fragmentation of record and data record. And deployment IA in healthcare is a major challenge in Tunisia and in the world. A success requires a clear regulatory framework and strong data governance in public and the private sector. Cybersecurity is very important, and clinician training is very important to educate the medical and paramedical person. Ethical governance and is important, and the close collaboration between government and the private sector and the healthcare providers, academia, and the private sector is very important, cooperation and PPP. private and public partnership. EHealth should support clinicians, not replace them, and always keep patient safety at the center of our preoccupation. Thank you.
Thank you very much. We are getting close to the end of this webinar. There's another question here about collaboration, real-time virtual multidisciplinary teams, specialist collaboration, complex case discussions. Any thoughts on that? He mentions further exactly in the digital hospital, how do you serve the patients remotely? Or is it really only in the diagnosis? Or are there other aspects like this multidisciplinary collaboration that's being put in place? And then a final question was more around, let me see here. Yeah, interested to know about the governance of telehealth and how to ensure that it's safe, consistent, at scale. So let's end with any thoughts or responses you can provide to that. Turning back over to our Tunisian colleagues. Dr. Abida or Professor Guider, would that be something you might have some answers to?
Yes, I will say that the virtual hospital in Tunisia is already giving clear help in the patient, especially that we have scarcity of radiologists, and now what has been done in radiology is really
You seem to be dropping out.
He was not able to join us, but which is working between the Ministry and Health and Higher Education. He is working on all these standards, and we have several academic work for this to implement.
Yeah, I'm afraid we're losing the sound. We haven't been hearing everything you have said.
I'm very sorry. So if Yusuf Abida can continue, he will probably have a best coverage than me. Thank you, Yusuf.
Okay, thank you very much.
Okay, so yeah, Professor Gützer talked about the experience of the digital hospital in Tunisia. It's not really a physical hospital; it's a department in the Ministry of Health. And what's happening now that that at the level of the regional hospital, let's say in the south or in the of Tunisia, physicians can perform scan or consultation. They send their data, it may be the images or the patient history, through a secure platform to the digital hospital in Tunis. There is a specialist that receive the file reviews and send back a diagnosis or maybe a recommendation, usually within hours. So the communication still bi-directional between the regional team and the specialist that can request maybe additional informations. But now it's not just radiology. We are expanding to other specialties like pathology, like dermatology, endocrinology, and I'm neurologist, and we did an experience with the digital hospital, and we saw some dementia patients for follow-up consultations. The digital hospital, I can say, is becoming like a national referral center, and that can help to tackle the disparities between the coastal area of Tunisia and the inner part of Tunisia. That's it.
Okay, thank you very much. So yes, I do understand that, yes, it's definitely more than just diagnosis. There's also consultations happening with the patient, and then also, between health professionals and different specialists, that there are possibilities to collaborate, to exchange with regards to a single case and a specific patient, etc. So with that, I would like to thank you all very much. First of all, to our colleagues from the Tunisian Society for Telemedicine and eHealth for putting this webinar together today. Also, our group of national members within the ISfTeH who are arranging this series of webinars. As we said, this is being recorded and will be made available on our YouTube channel. For additional questions that may not have been answered during this webinar, do not hesitate to reach out to us at the International Society for Telemedicine, info@isfTeh.org, or contact the Tunisian Society directly, and we'll be happy to address your questions or put you in touch with the right people. More info on our website, on our social media channels, and we look forward to seeing you at some of our next events. The next webinar in this series of national member society presentations will be scheduled in September, where the focus will be on Jordan with our national member over there, the eHealth Development Association of Jordan. And in between and before that, we will also still have some other webinars organized by other groups within the society. So stay tuned. We look forward to continue to engage with you and to hear from you. So thank you all, and look forward to seeing you very soon.
Thank you.